Hi, my name is Greg Fell. I'm Director of Public Health in Sheffield, and this is a brief clip to update on where we are in this epidemic. It's pretty clear to see if you watch the 5 o'clock daily press conferences that we're about at the peak of the first wave of the epidemic. That data is pretty clear. The number of new cases is beginning to plateau. The number of people being admitted to hospital is beginning to plateau. What's happened is that because of the social distancing and the lockdown that was imposed 3 weeks ago, the peak has been brought forward in time. We're expecting it to be a bit later, but the peak has been brought forward and it's massively lower. The hospital is coping really, really well, actually. So that's thanks to all of us who have abided by the rules of the lockdown. Lives have been saved. I don't know how many, we'll probably never know how many, but comparing what we were predicting with what's actually happening, we're in a significantly different place, in a better place. Of course, that's of no comfort to the families of those who have lost loved ones. I recognise that, but it's certainly not half as bad as it could have been. So what will happen next, I guess? My sense is that the lockdown will continue, and we'll then get into the business of a phased process of coming out of the lockdown, and we're working what that might actually look like. The other thing that I am worried about, and lots of us are worried about, is what's not happening in hospitals and GPs, surgeries across the city because of lockdown. And certainly a lot of doctors have said to me over recent weeks that they're not seeing people that they would expect to be seeing. And we think there's probably a big group of people who really, really ought to be using healthcare, but they're not because they're afraid that they may become infected, or they don't, for other reasons. So people may be avoiding care because they worry about going to hospital or going to see their GP. I think I'd say 2 or 3 things. The NHS is still open. There's still plenty of capacity in the NHS for face-to-face contact. We're still encouraging people who suspect they have coronavirus to use 111 online. But if your symptoms worsen, or if you have different symptoms, then you should use the NHS in the ways that you normally do. And GPs and A&E and other parts of the NHS are working really hard. They're still there. They're still open. And I'm worried that people aren't recognising warning signs that they ought to be worried about. Of course, if you have symptoms that you suspect to be COVID, call 111 or use the online service. But if your symptoms worsen, then you go and see a GP or call your GP. Things to take particular note of: if you're breathless, especially if you're older, and or if you develop some symptoms and have underlying heart disease or diabetes, you should be particularly worried there. And I think use your GPs, use your NHS as you normally would, because it is still there. And we're worried that people aren't visiting their GPs or going to A&E when they really need to. So we'd encourage you to use those services that are there.